A fast-moving Ebola outbreak in Eastern Democratic Republic of Congo and Uganda has been declared a public health emergency by the World Health Organization. The death toll has risen sharply, with hundreds of suspected cases now linked to the outbreak. Infections have been reported in urban areas of Eastern DRC, while neighboring Uganda has also confirmed cases.
Early on Sunday, I declared a public health emergency of international concern over an epidemic of Ebola disease in the Democratic Republic of the Congo and Uganda. This is the first time a Director General has declared a FIC before convening an emergency committee. I did not do this lightly. I did it in accordance with Article 12 of the International Health Regulations after consulting the ministers of health of both countries and because I'm deeply concerned about the scale and speed of the epidemic.
The outbreak is centered in Ituri province, where conflict, weak health services and delayed detection have complicated the response. Congolese health officials say early tests failed to detect the virus because they were looking for the more common Zaire strain, while the current outbreak is caused by Bundibugyo.
You see, this outbreak was detected very late, even too late. Why? Because when the first cases appeared, they took samples and sent them to laboratories, for example, the Bunia laboratory. But in these laboratories, they used the techniques we had used for the 2018 outbreak. They used specific cartridges for Ebola Zaire, and these Ebola Zaire cartridges did not recognize Ebola Bundibugyo.
Officials also linked part of the early spread to funeral practices before communities were aware Ebola was involved. The Bundibugyo strain has no approved vaccine or virus-specific treatment, though WHO says public health measures remain central to slowing transmission.
WHO has a team on the ground supporting national authorities to respond. We have deployed people, supplies, equipment, and funds. I have approved an additional $3.4 million from the contingency fund for emergencies, bringing the total to $3.9 million.
WHO says surveillance, contact tracing, safe burials, and protective equipment are now central to the response. Uganda has postponed its annual Martyrs' Day celebrations because of the risk of further spread. Some border crossings have seen tighter controls, but WHO has urged countries not to close borders, warning that unmonitored movement could make the outbreak harder to contain.